Yeah.
Hi there.
Hey.
Hi. I'm Dr. Michael Morrow. I'm one of the second-year radiology residents.
Oh, hi, Dr. Morrow.
Hi.
Yeah. Nick Kingston. How are you?
Good. You're Carol's husband?
Carol. Yeah, Carol Kingston, my wife.
Okay.
I was getting a little worried. She's been here for an hour already.
I'd like to explain to you what happened. Unfortunately, I have some unfortunate news, if you would mind sitting down with me. So, when we went back to do the CT scan, we were administering IV contrast as part of the examination, and she started to have an allergic reaction.
Okay.
Which happens often. So I was called in immediately to respond to her. She was having hives, trouble breathing, so we administered oxygen.
Okay.
It seemed to be getting worse, and she stopped breathing, and her heart stopped beating.
Is she alive?
She's alive, yes.
Okay. Is she going to be okay?
I think she's stable right now. She's in the ICU. She's on a ventilator. We restarted her heart.
Okay.
We got her breathing. Unfortunately, when I was called in, part of the response to that is to give epinephrine. And I administered...
I don't know what that is.
It's a drug that we use to help in patients in these situations where they've stopped breathing or their heart has stopped. And so, as protocol, we give this medication.
Okay.
Unfortunately, I administered an incorrect dose of the medication. And...
You gave her the wrong medicine?
Correct. Only a small amount was injected. We were able to stabilize her.
And she's gonna be okay?
She's stable right now. She's doing fine. She's on a ventilator, okay, and she's stable. She's doing okay right now.
Okay. You gave her the wrong. Don't they teach you how to give the right medicines?
They do, yes. And I apologize. I know this must be very shocking news to you, and I apologize for that.
So what are you going to do about it? How are you going to make this better?
So
is there something you can do to make to fix this? Where's she now?
She's up in the intensive care unit.
Okay.
And to answer your question, I'll do everything I can to help.
Okay.
Personally.
Who's with her right now?
She's being taken care of by the doctors that cover the ICU. I'm in radiology, so I don't typically care for patients in that setting. Okay. So she's in good hands with the intensive care unit doctors.
Okay.
Okay. And like I said, they're going to be taking excellent care of her and do everything they can to keep her where she is, and eventually she'll get better, I hope. You know, we often give people these medications. This often happens, that patients have this type of reaction, and giving the wrong medication, you know, is something that I'm very sorry for, and I, you know, do not like that happened. But
what's going to happen in the future? If she's okay, when will we know for sure that she's okay?
Well, it's hard to say for sure, but you know, she had a severe allergic reaction to this, to the contrast that she was given, and we were able to stabilize her despite the incorrect medication, and now she's being taken care of.
What is this contrast?
It's a diet.
She just needed to have a CAT scan, right? A CT scan, right?
Right. So the CT scan, most often we give what's called IV contrast, so intravenous contrast. It's a material that helps us better diagnose and find potential cause for her problems.
Yeah.
It's very standard to use. There are people that have reactions to it, unfortunately. And so that did happen, and nothing that we could control. The part that we did control was giving her the medications.
She was allergic to the stuff that you put in her before the CT scan.
Correct, and that's what prompted us having to give her the medication.
Okay. Is there anything that I can do? Is there something? Do I need to call? Do we know what? Do you know what allergy she has? Do we need to call Dr. Mallet
No, we have her medical record, and we should be able to look and see, is this her first CT scan?
First time she's ever had
Yeah,
this.
so if she'd had a previous reaction, we would have known that, but if we were not aware of that, then you can't ever predict these things. So do we need to, I think we have our medical records, so that's fine.
Okay.
In terms of what you need to do, I know, like I said, I understand this must be very
There's
difficult.
gotta be something I can do,
Well,
right?
you can support her, and we'll be able to take you
Can
up
I
to
go
to
see
be with
her?
her. Yes, for sure. We'll take you up there.
Is she awake?
She's on a respirator. I'm not
Okay.
sure if she's conscious or awake. I mean, she's alive, she's breathing, and, you know, we can definitely take you up there to see her and be with her, and I think that's the best thing you can do. I know this is a tough thing for you to have been given this news, but I wanted to make sure I'm
This
giving
was
it
just
you
supposed to be a
myself.
20-minute, I was supposed to go back to work after this. She was supposed to go back to school. This wasn't supposed to be here. Do I need to call the kids? Do I need to bring the kids in?
If it's something that you think she would like and you would like, then I think that's fine. I don't know, once again, I think we'll know more here in the next little time, and, you know, I think first maybe best for you to go see her and talk to her, and or be up there and talk to the physicians taking care of her, and see if we can get a better picture of what's going on in the short term, and then, you know, you can bring in your children if needed, and yeah, I understand it must be very shocking.
I don't know what to do. I can't wrap my head around what's going on now.
Well, what questions do you have? What are you concerned about?
Do we know how long she's going to be in the hospital?
Unfortunately, I can't, that's hard to say.
I see.
That's hard to say.
Do I need to call a priest?
You know, if that's something that you would like to do, I mean,
Is there a priest here in the hospital?
there are priests here in the hospital. I'm happy to help you find someone that can go with you. If you would prefer yours, you know, the pastor or your priest specific to you come in, that would be fine as well. But that's something we can help you with if you wanted to have the priest here in the hospital help you.
Okay. Does it look like she's going to survive?
I'm hopeful that she'll survive. I mean, like
Is there anything beyond that? Is it just hopeful? Is it 50-50? What can you help?
I don't want to give you
tell me
any.
about this?
I don't want to give you any false information, and so I want to try to stick to the facts. And once again, that's sort of out of the realm of what I typically treat or deal with. I know these contrast reactions happen commonly. It's not to this severity, and that's why we don't typically give the type of the medication that I gave you, epinephrine. Typically we don't have to give that, but when they have such a severe reaction, we do. How they do afterwards is different. Everyone recovers differently, and I don't want to give you false information. So the best thing to tell you is to reassure you that she's doing okay right now in the ICU. She's stable.
Okay.
And probably the best thing for you is to go up there and talk with the doctors up there, and I'm happy to take you up there.
I need to be there.
Yeah, I think you should.
I do.
What else can I help you with, or any questions that you may have that I can answer quickly before I take you up there?
Should I call her parents?
Yeah, once again, that's something if you think you would like to do. If you want to wait and talk to the physicians that know how she's doing right now, that might be good to wait, but that's up to you.
Okay. Maybe we should. I don't want to scare anybody, I guess.
Yeah, whatever you think's best. But yeah, I think hopefully getting you some answers in the short term would be
He will be able to
better.
give me some answers as far as how she's doing and what the future holds for her, yes?
Maybe a little bit more. It's always hard to tell the future. No one can tell exactly how she's doing, but they, once again, have treated people in these conditions a lot more than I have in recent time. So,
Okay.
does that sound reasonable?
It does, yeah.
Okay. Well, I'm sorry this happened, and I thank you for your patience, and I'm sorry. I know how tough this must be for you. But be assured that I'm going to take you up there, and if you have any questions, you can get a hold of me through the radiology department. I'm happy to help in any way I can.
Tell me again your name.
Michael Morrow.
Morrow.
Yes.
Okay.
I'm happy to help you in any way I can.
All right, doctor.
Okay?
That's time, please.
Thank you.